So we are gonna presenting to you the drug heroin. And first of all, I'm gonna show you our structure. We will start with the basic knowledge of heroin use and then head on to the chemical composition and the neurological impact. We also give you information about the behavioral effects and to finish about the consequences of heroin use. Now I'm gonna give you some basic information about the heroin use, and it's one of the most frequently used illicit opioids. It is very effective as a painkiller and analgesic, and is highly addictive. It was already used 4,000 years ago to relieve pain and to evoke euphoria. And Afghanistan is the primary origin country for heroin that is consumed across Europe. It was first synthesized in 1870 and it was marketed by the Bayer and Drug Company as a superior aspirin in 1898, and it was available without having any prescription. But in 1924, the US Congress made heroin possession, sale, and use illegal.
Heroin's chemical structure. Heroin is considered a primitive form of diamorphine, which is a narcotic analgesic drug used to alleviate extreme pain. This semi-synthetic substance is produced by the acetylation of morphine, which naturally exists in opium, which is the dry latex of some poppy species. Target brain structure. Heroin binds to and activates specific receptors in the brain, called mu-opioid receptors. Our bodies contain naturally occurring chemicals called neurotransmitters that bind to these receptors throughout the brain and body to regulate pain, hormone release, and feelings of well-being. The production of neurotransmitter dopamine is triggered by more activation in the brain reward region, which reinforces drug-taking behavior. Chronic heroin exposure causes neuroadaptations in various brain systems, including those related to cognition and stress response, in addition to reward circuits. The amygdala, hippocampus, cerebral cortex, and their linkages to the nucleus accumbens are among those significant brain areas impacted. Neurotransmitter involvement. One unique effect of opioid drugs' prolonged activation of mu receptors is neuroadaptation. Tolerance is characterized as a decreased sensitivity to the acute effects of opioids. Cognitive maladaptation in substance users includes things like an increased susceptibility to short-term reward and a preference for attention to stimuli connected to drugs. As previously mentioned, opioids have been linked to a variety of cognitive problems, both during and after periods of chronic usage. Research has revealed impairments in executive functioning. Some of them include deficits in inhibitory control, decision-making, strategic planning, and cognitive flexibility. Chronic heroin use has been linked to mild impairments in verbal fluency, verbal working memory, risk, and reward-based decision-making, according to meta-analytic studies. More recent research has shown that chronic heroin users exhibit visual memory, working memory deficits, impulsivity, and compulsivity.
Now we will talk about behavioral effects of heroin use. First of all, short-term effects. People report euphoria, drowsiness, loss of sexual drive. Some of them also talk about slightly elevated moods, sense of general relief. People become more relaxed, inhibited, lethargic, and may even fall into a stupor for a few minutes or hours, which means that person does not respond to any external stimuli. When the effect wears off, people can lose self-control and become aggressive, which is one of the symptoms of withdrawal effect. We will talk about this later. Concerning long-term effects, physical structure of the brain is changed, which creates long-term imbalances in hormonal and neuronal system. Problems with the decision-making mechanisms response to stressful situation are also often reported by chronic heroin users. Due to withdrawal syndrome, people become concentrated on drugs and wait to get it. Egocentrism, constant lying, and aggression can also be one of the main problems of chronic heroin use. People also report that they experience emotional and mood swing, which means that any stimuli can trigger them really hard, more than just like normal people who don't use the drug. If people use the drug for more than several years, they experience severe loss of memory and development of dementia, which can be the case after 5 to 7 years of heroin use. Also, chronic drugs users report personality degradation and cognitive decline. Heroin withdrawal syndrome effects. It usually starts after 6 to 12 hours after the last drug injection and lasts until the next drug injection or any rehabilitation event. This syndrome has four stages. During the first two stages, drug users become apathetic, indifferent, and ignorant, and it's not really dangerous compared to the last stage, which is the fourth stage, and it is the most dangerous and it can lead to death. Drug users lose self control and become dangerous for their family and friends. Once the drug user gets another dose of the drug, they get immediate relief, which makes them believe that only the drug can make them feel better.
So now, as a last point, I'm gonna talk about the consequences of heroin use. So first of all, the health risks. Of course, heroin use can affect the health. It can cause physical and psychological dependence. It can lead to overdoses and death. And also, long-term users can suffer from liver and kidney disease, from collapsed veins, pneumonia, and heart infections. So there are a lot of health risks in total. And of course, there are also social and economic factors. For example, there is an increased crime rate for long term users as they need a lot of money to buy their drugs. Then they are less productive as they focus on the consumption of the drug and to get the drug. So they may lose their jobs. Then there are also increased healthcare costs for the country as the heroin use can cause a lot of health risks and diseases. Of course, long term users can have some troubles with their family or their communities if they focus on the drug consuming friends. So it may destroy families or friendships. And as a last point, there can be also higher rates of homelessness as the people may lose their jobs and yeah, can't afford their homes anymore. So this is the end of our presentation. Thank you for listening and thank you for your attention.